Hi, I'm Craig Walker. I'm an interventional cardiologist at the Cardiovascular Institute of the South. I started this practice now 42 years ago in 1983, and I've done many procedures over the years. Certainly, one of the things most important to me as an interventional cardiologist is radiation protection. Radiation protection for me and also the people within the room with whom I'm working. Now, over the years, I've lost friends to cancers induced by radiation problems, but I've also watched the myriad of orthopedic problems seen because of the leads that we wear. I'll show you my own problem. If one looks here, you see I have a longitudinal incision. Many years ago, I had a 5-level cervical fusion as my spinal cord was almost transected simply, and I think in large measure, from wearing lead. I was doing a case and I realized I could not feel the fingers in my left hand. And after the case was done, I took a pin and I pricked my finger and I could not feel that. I realized I had a problem. MRI suggested multi-level compression of my spinal cord, and ultimately I went off for a neurosurgeon to perform a treatment of my cervical spine. I've been lucky. I've recovered from that. I've been able to do more cases, but many of my colleagues have had surgeries on their back, on their neck, on their knees, other areas which we know are associated with having to wear heavy leads that apply our weight to our spinal canal. Now, I've been very, very excited about GLift since I've had this device. GLift has an internal skeleton which one tightens and it places the weight of a lead on one's hip. So you use your standard lead and you can get whichever weight lead you wish, but this elevates it such that the lead is not pulling down on your shoulders and therefore on your spinal canal. Instead, it places that weight on our hips. And we do that by having a belt that tightens, and with that and this internal skeleton which goes above our shoulders, it takes the weight off of our spine and puts the weight on our hips. I found this to be very helpful. I've found certainly that when I wear this, I don't hurt as much at the end of the day. And often I find this comfortable enough to where sometimes I forget to take the lead off in between cases when I'm speaking to patients. I think this represents a really, really big improvement in radiation protection, which gives us all of the radiation protection that we seek, but without as much of the orthopedic problems that people have faced in the past. I endorse this and certainly would recommend others to look into this.